Send me the commercial.
Okay.
I think it was in one of our presentations, but I
It,
want to make
it
sure I
was
had
in
that.
the Mac, right? No, yeah.
Oh yes, it was at
No, it was
the.
that OAS meeting, the
Yeah,
OAS one.
yeah.
That's what it was, OAS meeting.
All right. And now we are live. All right. Hello, everyone. Welcome to the Onslow Memorial Hospital Facebook Live. Today we are learning all about allergies with Dr. Stephen Spencer, our Chief Medical Officer, and Dr. Myron Yensha, our otolaryngologist.
Very good.
And if you have any questions, please feel free to leave them in the chat below and we will answer them as we see them. Um, and I will let Dr. Spencer and Dr. Yensha take it away.
Great, thank you.
Thank you.
So this is one of my favorite things that I always say I love to do, which is the Facebook Live. And I especially like it that I'm doing it with Dr. Yinsha. Dr. Yinsha is a team player. He is someone who's been very loyal to Onslow and is just a wonderful, wonderful doctor, a wonderful asset to our organization. So first, I just want you to talk to the folks on Facebook about why you decided to go into ENT and then how you arrived at Jacksonville.
All right, sure. Well, thank you, Dr. Spence, for that great introduction. So, I always liked, so initially back when I was going to med school, I liked really facial plastic surgery. Didn't really know too much about ENT. I did a rotation, unrelated ENT, where I had some exposure to that, and I said, hey, it just sounds like an interesting field. So then I pursued it more, and then I decided this is something that I want. It's so varied. You get to do a lot of different things, not only facial plastics, but ear surgery. We're probably one of the bigger specialties that operate on the pediatric age group without specifically specializing in pediatric surgery. We do sinus surgery, we do head and neck surgery like thyroids, parathyroids, carotids, salivary glands, and we also do allergy, sleep medicine. I'm actually board certified in sleep medicine also. So it's just very varied, and the age range goes all the way from pediatrics to geriatrics that we see.
So it sounds like never a dull day, and you
Never.
get to do a lot of different things on a lot of different age groups. So
Yes.
sounds like a great profession, right?
Yes, it is.
So how did you end up in Jacksonville? Tell me about that journey.
All right. So Jacksonville. So I was in the military, and after internship, I was assigned to the Second Marine Division as a general medical officer. So I was a battalion surgeon, and I liked the area. And so I always wanted to live near the beach. My wife is from North Carolina, further west and from Gastonia, and she wanted to come back to North Carolina. So once I retired from the military, we decided to set up shop here. I actually saw an advertisement for Jacksonville and said, hey, I know that. I would like to work there, and then that's how it all started.
Yeah, it's a great story. You know, we get lots of our docs who trained in this area and then came back because they wanted to be here, which is very good. You know, we have a great area and it's sort of a secret. Lots of people don't know about it, but once they find out about the area, how accessible it is to the beach, like you said, is great.
Right.
And I am really someone who loves to learn about geography, and I'm not from North Carolina, so every time someone mentions a town, I always go to the map and try to figure out where it is. I do know where Gastonia is. It's
Yes.
about 1 hour west of Charlotte.
Yes.
So I did my research about that one beforehand, so that's great. Um, so the topic today we're going to discuss is allergies. And of course, this is a great time of year to discuss allergies. Lots of folks have spring and summer allergies, and certainly it's something that a lot of people deal with. Can you tell us about, first of all, sort of what are the initial treatments that people usually use for allergies out in the community, and then how would they get to you for more significant allergy treatment?
Sure. All right, so the most common allergens we're going to talk about are going to be inhalant allergens, which we see out there, the dust mites, they're the dog dander, cat dander, trees, grasses, the pollen, ragweed, stuff like that. So initially, though, this area, first of all, this area is really, there's a lot of allergens in this area, which then leads to other conditions, such as sinus conditions. So some of the symptoms that patients will be usually a runny nose, they'll have maybe watery eyes, sneezing. But some of the other uncommon ones that you may not realize are due to allergies would be problems with your ear, like you can't clear your ear, like you feel like there's fluid in your ear, or you may get a scratchy throat, you feel like you have a sore throat. Those are some symptoms that are related to allergies. And depending on how allergic you are to something will determine what kind of symptoms you have. So what we usually do is the first line of treatment is going to be an antihistamine. You have the newer ones like the Claritins, the Zyrtex, the Ranitidines, the Terrazine. Those are more non-sedating. Then you have the older ones such as the Benadryls, which are sedating, but they work just as well. A nasal spray is also good, so a steroid nasal spray, something like Flonase. And there's other ones, but usually we start out with Flonase, the kind of the basic one. And then you have other nasal sprays that are like an antihistamine nasal spray. So initially I'll start the patient on an antihistamine by mouth and then a steroid nasal spray. And also I'm a proponent of a nasal irrigation. So irrigating the nose out, and what that does is it kind of clears the allergens out of the nose so they're not irritating continuously, especially if you've been outside.
Good. And you can't have any conversation nowadays in healthcare without mentioning COVID. So are you finding that people are having a difficult time figuring out if, it's just their normal allergies or maybe they have a mild case of COVID?
Uh, Usually, that hasn't been an issue. Usually with the allergies, they're kind of persistent. The patient knows about the time of year. COVID, now, yeah, you're right, it can mimic allergies. But usually with COVID, they tend to have some loss of taste and smell, run a fever, and just kind of overall just don't feel right. Which people that do have allergies differentiate that pretty readily. They'll know when the allergies are acting up and kind of when it's something else.
So their normal allergy symptoms is a giveaway, and then the time period, usually the allergies are going to be longer than an acute case of COVID.
Right.
So tell me, what happens beyond that initial treatment with sort of the oral medications as well as the inhaled steroids?
All right, so if we get to the point where it's helping with the symptoms but not quite, let's say patients now, they just have persisting nasal congestion, they just can't breathe through their nose. Medicines have helped a lot. The next step that we could go to is pursue with allergy shots. So you have that, that can be done at an allergist. They'll give the shot. And depending on how bad the allergies are, they could be either twice a week, once a week, and they usually last 3 to 5 years.
Okay.
Now, from our standpoint, there's surgical options that we could offer. We could reduce. There's things in the nose called turbinates, they congest. And you actually may see it if you look in your nose when it's really stuffy. So we could shrink those down. We could surgically straighten out the middle portion of the nose. And then there's also these devices we have that will ablate or kind of destroy the nerve, the posterior nasal nerve, that kind of innervates the glands that cause the congestion or the runny nose. So there are surgical options, but the patient has to be aware that the surgery will not treat the allergies. You still have to use the medications.
Gotcha. Tell me more about the turbinate surgery. I'm interested in that. How does that work?
So the turbinate surgery, what we usually do is we use a device. It looks like like a long needle. So you stick it in the middle of the turbinate, kind of the soft part or the meat of it, if you will. And you want to ablate or destroy the tissue, the erectile tissue, so the turbinate doesn't blow up, doesn't get large, it just stays small. You really don't want to take the whole thing out. You probably feel good for about 6 months, then you're gonna feel miserable.
Okay.
So we learned over years, early on they used to take out the whole bone, but then we learned that's not a good idea. So now we just kind of direct our treatment towards the erectile tissue and try to shrink that down to prevent it from swelling up.
Okay. And how would people get to you? So certainly it sounds like there's they could, if they have allergy symptoms, they can come directly to you. But tell me about all the ways that a patient can get to you. And when would you suggest they come to an ENT doctor?
All right, so some of the ways that you can get to us is have your primary care send us a consult. If your insurance company doesn't require a consult, you can contact us directly. But for the majority of the time, it's usually we get consults from the primary care. I would say if you've been on medication and it's just not working, then that's the time to see us. Because also, which I didn't mention, which I'm going to mention now, is another cause that allergies can cause are polyps, nasal polyps. And they may not be readily seen on just routine exam. We may have to put a scope in your nose to make sure you don't have polyps. And that could be a cause of obstruction and constant drainage from the nose. So I would say if you're on these medications, say you're on a nasal spray and you're on an antihistamine, and it's just not working, you still feel really congested, then I think that's a good time to come and see us. And then we can do a thorough exam to make sure you don't have anything else going on.
Gotcha. And I want to correct something that I said that you said correctly, but I didn't, which is it's an intranasal steroid, not an inhaled steroid.
Right.
That's what you're recommending. Great. Is there anything else that you want to say about allergies or about what you do?
Yeah, so we actually do the gamut of ENT surgery here. You know, we tube surgery for the children, tonsils and adenoids, the nasal surgery, not only for allergies, but we do also some external nose surgery. We straighten out the septum to help people breathe better, so breathing surgery. We do neck surgery, such as taking out thyroids, the parotid glands, salivary glands, voice surgery, so we operate on the vocal cords. So pretty much everything in the head and neck we do. Now the major stuff, like for head and neck cancers, we'll see you initially, kind of get the diagnosis, and if it's something that we cannot handle here, then we'll usually refer to UNC, where they have subspecialists up there that'll take care of stuff.
And that's a really great thing. You know, certainly I applaud Dr. Yinsha for everything that he's done. And the other thing I think that you allude to is the fact that you actually cover a wider gamut of procedures and services than even normal ENTs. And part of that is because in this area, because we don't have a lot of the subspecialties that you would see in like a really large city, you guys will handle a lot of that stuff. So really, if you're unsure, or if you're a primary care doctor, you're unsure, make the consult. You'll make the determination about whether or not it's appropriate for you to handle.
Yes, absolutely.
Great. Well, I thank you, Dr. Yinsha, for your time, and I will turn it over to Sophia.
Yeah, so we don't have any questions, but I had some general questions prepared to put you guys on the spot. So what is a safe and effective way to treat like very basic seasonal allergies? Like they don't, you know, I don't necessarily need to come into ENT, but I have sniffles every day and it's just a bother more than anything, you know?
Yeah, that's a good question. I would start out with an antihistamine. So Claritin, Zyrtec, you know, the Ranitidine, Cetirizine, Allegra, and intranasal steroid spray. The only one over the counter right now is Flonase, so I'll do Flonase. I usually recommend 2 sprays twice a day, and then take an antihistamine. It's also good to buy those Neomed irrigation, so you can start irrigating the nose. But I would do that initially and see how serious symptoms are.
Okay.
What the gentleman said.
And at what point would a patient want to come in for like a consult? Like how, you know, what intensity?
You know, it could be vary. I mean, you could come in right away if you know, if you feel you're just having difficulty breathing through your nose, or as I said earlier, if you've been on the medication and it's just not working, and you still feel you still have a lot of symptoms, running nose, you just can't breathe through your nose, then come in and see us again. Like I said, you may have nasal polyps, and really the only way to see those is for us to use a scope to put inside your nose and take a look around.
Okay. Well, I think that was it. Do you guys have anything else you'd like to say?
I think Dr. Yinsha has said it all.
All right. Well, thank you guys so much for joining us, and thank you, Dr. Spencer and Dr. Yinsha, for being a part of this Facebook Live. As always, they're very informative and very helpful. Feel free to leave a comment with more questions, and we can get back to you. And let us know what you'd like to see in the future for Facebook Live. Thank you.
Thank you.
Thank you.